Well, we have heard the sneezing and wheezing and seen the pollen coating cars in the Coastal Empire for a couple of months now. I remember even before the golf season, we had people dealing with allergies in our office. But May is National Allergy Month, Allergy and Asthma Month, and I want to take a look at that with a local allergist. Allergies and asthma are actually a lot more connected than you might have realized, with one often setting off the other. So Dr. Wasil Khan, a SouthCoast Health allergist, outlines some of the things that we can find at home and outside the home that could lead to an allergic or asthmatic reaction.
Asthma is something that affects perhaps 25 to 27 million people here in the United States. It affects adults and children. And most asthma has an allergic trigger. You can have various triggers for asthma. Indoor triggers that are common to trigger allergic asthma are things like pet dander, dust mites, sometimes mold if there's a mold issue indoors. Outdoor triggers are very commonly pollens, and again, molds are prevalent outdoors as well. If you experience symptoms that suggest an allergy, nasal congestion, sneezing, runny nose, cough, wheezing, shortness of breath, sometimes skin allergies like hives, eczema. Talk to your physician about it, because there are other conditions that can mimic an allergic sort of reaction. Once it's determined to be an allergy, you can use various medications. If you know you have a certain season where you have trouble, you can start a medication ahead of the season, and hopefully it will allow you to get through it without too much trouble.
Well, Dr. Khan said the over-the-counter allergy medicine helps most people, but if you have not experienced any allergies so far this spring, he warns there's going to be another allergy season that we see in the Southeast begins around the end of the summer. I'm going to knock on wood and say, fortunately, so far, I have not had any allergy symptoms, have not dealt with them in years, but he also said that it's something that could pop up late in life. It's something that you can experience for a while and then go away. So you never really know what you're dealing with completely.
Yeah, I dealt with allergies really all my life. When I was a kid, they did the back prick to show, and I lit up like, you know, a scoreboard with everything. Experienced them, went out to Oregon, weren't as bad, moved back to the South, and it's like, okay,
and here they are.
Yeah, so I've got my regimen of, and it's all over the counter now, and don't really have to deal with it other than just taking the medication, and I feel like I'm okay.
Well, the good news is the second allergy season, the fall allergy season, it's a different pollen, so maybe you're not allergic to that one and you won't have to deal with too much.